Hey there. Thanks again for listening. It's Andre with another episode of the Impulsive Thinker podcast for the high achieving ADHD entrepreneur. This episode is brought to you by CADAC, the Center of ADHD Awareness Canada. You can get more information at www.cadddac.ca. Today, I've got a special guest, Christina Crow. She's a registered psychotherapist in Ontario, Canada, an entrepreneur, and a relentless mental health advocate. Christina is the founder of Dig a Little Deeper, the psychotherapy and counseling, which is a modern self-managed group practice with 17 psychotherapists, counselors, and therapy interns. They provide both in-person and virtual services across Ontario and Prince Edward Island. Christina can't help but speak up for issues in mental health. I can attest to that, like advocacy for women and access to care in our hodgepodge system. That's a polite way of saying that. Christina also serves on the advocacy committee for CADRA, which is the Canadian ADHD Resource Alliance, which is more on the medical side of ADHD, and has been a past board member of the OAMHP, the Ontario Association of Mental Health Associations. And in 2022, she launched the first psychotherapist-led podcast in Ontario, highlighting important issues in women's health, mental health, interviewing mental health leaders and leading experts. I was one. I was on her podcast. It was fun. And her creative outlets most recently include skiing, horseback riding, mastering the art of growing a tomato. We'll have to talk about that later, and spending as much time with her family as possible. Christina, thank you for joining us, because I think today's topic is quite important to understand.
Thanks for having me. I'm excited to be here. Love talking to you about these things.
Yes, it's always a great conversation, and we have to cut it off because of schedule, or we have to be somewhere else.
Right.
So,
right.
What I want to talk today is you're a psychotherapist, correct?
Mm-hmm. Yeah.
And first of all, what does that mean?
Mm-hmm.
And then a lot of questions you've had is, what's the difference between that ADHD coaching? So I'm wondering, can you give us what is a psychotherapist? And if you could also explain what's the difference between a psychotherapist, a psychiatrist, and a psychologist, maybe to give us a little more context, and what a psychotherapist does.
Sure. So I am a master's level trained mental health clinician, meaning I am trained to deliver the treatment of serious and issues that cause dysfunction in our lives from the mental health world. So depression, anxiety, trauma, PTSD, all those sorts of things. Psychotherapists in Ontario go to like master's levels programs and can assess and provide treatment. They don't diagnose. If you need a diagnosis, you need to see a medical doctor or a psychologist. And psychologists are usually PhD level trained mental health clinicians. A lot of them do research. A lot of them work in hospitals and in kind of major programs. And a lot of them do assessments for things that we know about, like ADHD, psychological assessments, vocational assessments, long-term disability claim assessments, psychoeducational, that sort of thing. The only people in Canada that can prescribe medication for conditions are MDs, doctors. I think that's kind of the major diagnosis.
And that'd be the psychiatrist.
Yeah, psychiatrists or physicians who work in mental health, usually with more complex mental health conditions. And ADHD is on its own not. It's actually a really simple and easy thing to treat, and people do really, really well when they find the right clinicians. Unfortunately, there's not a lot of trained ADHD specific clinicians.
Can you explain on that a little bit? What do you mean by there's not enough specifically trained ADHD clinicians?
Yeah, so across the board. So from medical school, psychology programs, master's levels, PhD, ADHD, you're lucky if you read a paragraph about it in your programming. So anyone out there that currently is a specialist in ADHD, like declares themselves a specialist, has probably gone and done lots and lots and lots of training postgraduate.
Yeah, because I'm going to say, I think I was very fortunate that the psychiatrist I ended up getting, actually in the public health system here in Canada, he took an interest in himself to learn about adult ADHD. And even then, correct me if I'm wrong, having clinicians or even psychotherapists or any doctor having any knowledge of adult ADHD is quite rare.
Yeah, they're unicorns.
Yeah, and even to the point where my general practitioner to this day still says, I don't believe you have ADHD because of all the successes you've had.
Yeah.
Yet I highly respect the psychiatrist who diagnosed you, therefore I shall believe.
Yeah.
So,
I mean, as science marches on, right? So like we've been talking about ADHD and it's been talked about in the medical literature for like 200 years.
Right.
So
just named differently.
Yeah, named differently. And some of the descriptors have popped in and out of diagnostic criteria. I think where we go wrong is people look at like DSM diagnostic criteria as like a rule, and it's not a rule, it's guidance. Like ADHD is a clinical diagnosis. So there's no x-ray, there's no blood test,
right?
There's no gene test. It's someone who's really trained, who sits down with you and can do hours and hours really of assessments. I mean, it's a misnomer that you can take a screener and declare that you have ADHD because some of the symptoms fit, right? So it is a little bit more complex than that.
Well, for me, it took almost a year and a half. It took a year and a half to get the diagnosis after multiple meetings and discussions and other assessments.
That's actively trying to get the diagnosis.
Correct. Yes.
Right.
Yeah.
I mean, you know, for the average, I think the CADAC data shows the average woman, it takes 20 years. And in that 20-year time period, you've been misdiagnosed with a whole bunch of other things, right?
Right. So is that actually an active diagnosis of ADHD, or is it just misdiagnosis until ADHD comes to fruition? Like I understand, and I'm not doubting that, you know, even a lot of adults are overseen or misdiagnosed until it's ADHD later.
Yeah.
So,
well, I think what the data shows now is like maybe 25% of ADHD is a simple, straightforward ADHD alone. And about 75% of it is ADHD plus anxiety, plus a mood disorder, plus some developmental trauma, which, you know, people come up with all sorts of ways to cope with that. What walks, the most generous thing I can say about the issues we have with diagnosis in this country in particular is that when you're an adult who doesn't know you've got ADHD driving those other conditions that have been happening in your life, when you sit in front of a clinician, what it looks like is actually depression and anxiety. So on the surface, it's not incorrect. And if we're practicing to be least invasive and the simplest, most obvious thing first, people can make some gains with some initial strategies, either medication, therapy, or both for anxiety and mood disorders, right?
Right.
The problem is that to come back months later and say, you know, I felt a little bit better, but I'm still having this problem and these things are still going on, it takes executive function.
Correct. And I think that's where a lot of people don't quite understand. And one thing I've learned is that if you're treating the depression or anxiety or whatnot, and the challenges are still there, maybe that you can treat the depression, but the challenges are still there. We're not getting to the root core of the challenge or the problem.
Yeah.
Now, and I've also read a lot of places and having conversations with many people is once they treat the ADHD, the depression, anxiety goes away, or at least gets reduced a lot
organically.
A lot results. Yeah. And I think that's an important thing I think a lot of clinicians I don't know if that's the training or that's just the way, or I know like in an engineering world, if you're taught a certain way, that's the only way you're going to see it. And I'm an oddball in engineering because I was taught a certain way, but I always like to go a layer too deeper to get to the true understanding so that when I see something slightly different, then I can apply the appropriate solution.
We're curious, right?
Yeah.
You see something that doesn't quite match your training and it's like, you know, this is, you know, that the saving grace of how we're trained is as a psychotherapist, if I approach something with a certain collaborative way, like, okay, you know, you've come to me with this issue, you're reporting anxiety, this sounds like anxiety, here's what we know works, is that cool? We'll do that for a bit. It's when you do those things and then things aren't getting better, or there's like lingering things that are a problem, that's when the radar comes up. And it's really important to realize it's not like the patient that's not that's failing, quote unquote. It's actually the treatment. We're actually probably treating the wrong thing. And it's a really important perspective shift.
Right.
I think a lot of mental health has trained people to view something within the person as wrong that needs fixing. And
Wow. Yes.
the ADHD piece that really opened my eyes after I graduated from my program was like, well, there's actually nothing wrong with this person. I spent like 2 years, like kind of shaking my head at the end of every week, thinking I just spent a week like reassuring everybody about how normal they are. Like, what's going on here? These people are convinced that there's something wrong with them. They're lovely. I have a wonderful time with these people and the work that we're doing. And so what I kind of recognize is when the interventions are actually outside of the person and their environment, when we're looking at the situations they live in, the experiences they've had in their lives, you know, all of a sudden, what we're working with is like, you're just a human. There's not a problem to be solved here, right?
No.
So, you know, I mean, the ADHD thing came kind of naturally to me. And then I nosedived into it post-grad when, you know, it became obvious that this was a thing that I didn't learn about in school. And so I would say any therapist or psychologist or physician, there's a lot of doctors with ADHD who specializes in it. It's probably because they have it themselves or someone in their family has it. So they're forced to learn about it. Correct. And when you're forced to learn about it, it is one of the greatest like corners of mental health to be in, because it's a lot of fun to work with people with ADHD.
I know a lot of people are forced to learn about it, but they don't learn adequately to do anything about it because it's difficult.
No, I mean like the deeper experts.
Oh, the deep
people
okay.
who love,
gotcha.
Right? Like the declared, I'm an ADHD person. Come see me. I mean those people.
Yeah, like for me, when I got the diagnosis, I just hyper focused for a good year and a half, just researching whatever I can read, a lot of self-reflection, observations. But before I get too far into that rabbit hole, I want to point out to the listeners, there's two things that Christina just said there. If it is not getting better, then something else is potentially wrong that needs to be treated. Yep. And to also recognize that with your loved ones or other friends. Like I know for me, I know sometimes it's best to treat the depression first in order to get the ADHD. And that's a tough call by the clinician or someone. I've heard somebody says sometimes you need to control the anxiety or the depression
at the same time.
But a lot of times, if we can get the ADHD under control and managed, then the other stuff kind of disappears or it's easier to deal with. And I know for me, it was the depression plus the ADHD brain just likes, that's the wrong term, but we do get a lot more depressive moods, cyclical depressive.
The emotional like regulation piece. Yeah. And if you think it's your fault, like if you think you have some control over that you're faulty in managing that without recognizing there's like an organic process driving that in your brain. Yeah. Then that is kind of depressing. Like you would feel like you don't.
Well, and then it takes time, and you can't take a pill to just fix it. It takes time. Like medication is part of the treatment, self-awareness, education, and do the physical work. That means you got to change your ways and look at yourself and say, this is not maybe something easy to handle or deal with, or whatnot. And the other thing, what I wanted to point out was fixing the person is the wrong way of doing it in mental health.
100%.
Right. And that's another key one. And for me, it was like, my brain is the way it is.
Yep.
Society can suck it. Sorry to say it, but this is how I am. And I don't want to be normal, and try to stop normalizing me was my big resistance. And there's nothing wrong with not being normal.
Yeah. Typical. Right. Yeah.
So, okay. So psychiatrist is a medical doctor that can prescribe, and you said they deal a lot more the complicated diagnosis and assessments. Yeah. Yeah. Okay. Yep. Psychologist psychologist, they can't prescribe medication, but they can assess mental health conditions. Yeah. And arguably a lot of people, I think there's movements to have psychologists be able to prescribe mental health. Yeah, just like the nurse practitioners. It's kind of the only difference between them and psychiatrists, as far as I can tell. So the psychotherapist now, what's your role, and what exactly does that mean? Because we got the other two, psychiatrists, psychologists. We got
Yeah.
those rules. What do you
So
do?
outside of medication, we provide all of the psychosocial support. So that means, talking therapy, helping people work their way and heal from developmental trauma, which is bidirectional with ADHD. There's a big misunderstanding, I think, out there in the, social media world of therapy that that ADHD can be caused by trauma in some ways. I think people extrapolate research and intergenerational trauma on like mouse populations a little bit too much sometimes.
It doesn't cause it, but it does amplify the complications.
Exacerbates and amplifies it, and it makes you more vulnerable to all the further mental health conditions that come as a result of like shitty things happening in your life.
I like that word. You're more vulnerable to the other conditions. Well said.
100%. You're more vulnerable to manipulative relationships, doubting yourself,
guilty,
anxiety.
Guilty. Keep listening.
Yeah. And so all of the things. And so what we can do is come in, do a full assessment of like all the things, and so psychotherapy, I do want to clarify, isn't the same as counseling. And I think the general public really uses those words interchangeably. Is it a big deal? I don't know. It depends on what you're looking for. So psychotherapy is really about creating psychological change. Someone knows they need to change something about in the way they experience the world emotionally, mentally, all those kinds of things, or their relationships. And so you come to psychotherapist for that, right? Okay. Counseling is more like advice giving. It's more like, oh my God, my mother-in-law drives me crazy. She's coming to visit this weekend. I need some like tips on how to manage that. Right. So it's more, it's not quick fix, but it's just more, a little bit more surface. Psychotherapy is everything that's driving things underneath that surface. Like that's what psychotherapists kind of want to get into.
I never realized that. Oh, thank you for that. That makes a lot of sense to me.
Yeah. And the difference between, and then all of these different clinicians can provide quote unquote therapy. And therapy feels really different sometimes depending on the provider. So for people that are listening, it's okay to ask the therapist, how do you do it and why? Like what informs your philosophy about what you're doing? I sometimes, and sometimes I've also said to people, you know how like you have to go to your family doctor for regular stuff. And if there's something serious, really deep, you get referred to the cardiologist or whatever. So I kind of think of us psychotherapists, like while we all specialize in different areas, like we're the generalists of mental health.
Right.
So we can kind of assess all comers, like all things, and then help you decide whether we can help you or whether you need a specialist in some other pocket of the system. Okay. You know what I mean?
Yep. I know that total clarity for me on that. Because I also wondered what the difference was a psychotherapist and a counselor besides just dollars.
Yeah, and
well, that's an assumption I make.
There's social workers out there. So there's some social workers that provide psychotherapy, and there's social workers that provide counseling.
So less. Yeah, go ahead.
I was going to say less than like the designation sometimes, like unless it really matters to you because that's what your insurance determines you have to do. When you're interviewing a new therapist and it's, it's like you got to kiss a lot of frogs sometimes, right? Like you got to find the right one that's the right fit for you.
Right.
Like their orientation towards the work and towards what psychological change is and how long therapy takes, like real good life-changing therapy.
Takes a while.
But it's an investment in yourself that is pretty, it's hard to.
Two things you just said that is very important. So the question we should be asking, do you provide psychotherapy or counseling would be a question.
Yeah.
And the other thing she said there, which is really tough for ADHD people, especially when you had a negative upbringing or negative energy around your undiagnosed ADHD or even diagnosed ADHD, invest in yourself. That's what it is. Psychotherapy, therapy, like I'm going through dialectical behavioral therapy right now. And it's investing a lot of time. It's taking some dollars, but it's okay to invest in you so you can be better. And we were raised in a society where that's selfish thinking. You got to be doing it for other people. You know what? Yeah. No, you got to take care of yourself first. And I was talking to another person on the podcast where they say, take care of yourself first. But I think what we got to do is actually take care of our mental health first before I can take care of me first or second. Then once you're taking care of it. Right. I think our mental health is way more worth it than our personal self. I think I'm going along those lines in theory right now.
Yeah, I can layer the coaching piece on now too, because you asked.
Yeah, that was going to be my next question. So we talk about counseling, psychotherapy, but there's a lot of ADHD coaching out there, and what's the actual difference between that?
So it at its core, psychotherapy is very not directional. It's very driven by what a person brings into the relationship. What I have found when working with people with ADHD, if I ask them really open-ended questions, often the answer is like, I don't know, man, that's why I'm here. I thought you were going to tell me. So I find people with ADHD, while they do know themselves well, they really appreciate having some framework and some guardrails to bounce between. So ADHD adapted psychotherapy, so this is the difference when you see a therapist that knows ADHD really well, actually is quite a bit more directional than traditional non-ADHD lensed psychotherapy. Meaning, if I ask somebody about a particular experience and I can tell they're kind of grappling to describe it, I won't just leave them there spinning their wheels, because that's just an exercise in frustration. But I will offer like maybe multiple choice. Is it more like this or is it more like this? It's like the warmer, colder game, right? Okay. And then that really helps qualify the experience. So it gives me information, it helps them find new language with which to describe their experience and validate that, yeah, man, like this happened to you and it shouldn't have. And that was a real thing that happened. You didn't just imagine that, that kind of stuff. I've always said that the therapeutic skill set, if you can imagine like a continuum, on one side of the continuum is therapy, which is all the things that we do to feel better, back up to baseline when we've been feeling badly. And the coaching skill set is the part that takes us above the baseline from kind of neutral to thriving.
Okay.
I think a great therapist probably does both a lot and integrates the two skill sets. And then ADHD coaching really focuses on, once we kind of feel better and you believe you actually deserve to have a great life and you actually can see some of your strengths, here's some executive function coaching stuff that we need to be aware of. And the executive function piece is important to even know what that stuff is. And I learned nothing about those things in grad school, because executive function goes offline in a lot of mental health conditions, not just ADHD.
Right. True.
ADHD, it's just offline and online and no particular rhyme or reason as to how it goes. And other people can't count on it, never mind us being able to count on it. Yeah. And it's kind of essential for adulting.
In theory.
Like just, getting along in the world, having just in relationships, right?
Well, that's why they say a lot of adults are getting diagnosed because of once you become an adult, or like kids graduating to college, university, and then becoming an adult. That's where the executive function really gets challenged, and that's where things start to fall apart.
Yeah. Right? Well, and people come up with humans are wily, incredibly adaptive people, come up with all kinds of strategies and ways to figure things out and make things work, or land in careers that are quite structured and handed to them. So, I personally think there's lots of undiagnosed ADHD people in certain pockets of different careers because the careers are so structured. So they actually do well. And it
supported their ADHD.
Yeah. So it's great. They've landed in the right environment. But the thing that lingers, despite whatever symptoms anyone might have had at different times throughout their childhood or teen years, are interpersonal problems, relational problems, because the basic ingredient for having a really healthy relationship, no matter what kind of relationship values you have, is the ability to pay attention to it.
Right.
And when we can't pay attention to it, the person on the other participant in it feels that, or they feel the hot and cold of it.
Yeah. And I also think with the high achieving ADHD entrepreneur, yes, the interpersonal effect has it. We all feel that. I think the other layer that's for me, was a big eye opener and just clarified a lot of stuff, is the executive functioning. Yes, I had my own system. I had my own processes. I was able to subconsciously create systems and mechanisms that worked to mask it, or at least be on top. I spent a lot of energy, and then in getting that final clarity to control and restructure my environment to either harness it better or to delegate a lot of it, clarified a lot of it. Now I'm able to enjoy the stuff I do better because I'm not doing a lot of stuff that complicated what I thought was working well. I think
Yeah.
that's a big misnomer, is that we think it's working well,
Yeah.
yet we can still do something a little better to make it extravagant. And
Mhm.
that's what I like to work with people, to get that extravagance out and work
Right.
within your strengths and abilities.
Right. A lot of adults with ADHD don't actually know what their strengths are.
No.
Yeah.
And the thing is, a lot of them actually, they do know, they just don't realize what it is, because they're actually were shamed for it.
Yeah. They're
And
criticized for the very things.
right, criticize it
Yeah.
seems so easy, or you're just being lazy because you don't want to do anything else. But like, no, that's whatever you feel is natural, that you do well and enjoy doing, man, that's
Yeah.
what you need to do. And that's what I like, working with people to get that side out. And like, I just did it the other day. I validated a guy. He was like, oh, being stuck on Facebook groups to do all this research is, I love doing that, but I was told I'm wasting my time. I said, no, that's the way you work, man. You get all the information to make proper decisions. And all of a sudden it's like, okay, I'm doing that. I'm going to hire people to do this other stuff that I was told I was supposed to do. Perfect.
When I am working with people who are in that high achieving entrepreneurial, like executive level type roles in their work life, you know, they've landed in a place where they got to do their hyper focus for a job.
Mm-hmm.
So if your hyper focus is something that's going to make you money one day, like, is that a problem to be fixed? No. It's great. Do it. It's awesome that happened for you. The problem though that we work on is, how do you pull yourself away from that to pay attention to the rest of your life?
Mm-hmm. Well, like, that's a challenge.
If you have a partner or kids or something, right?
Yeah. And a lot of us, I still struggle with that, because I enjoy intellectual conversation, intellectual thinking, and just that I really enjoy that. And how do I stop it to go do stuff at home? It makes it sound like I'm complaining, but it's just, it's a shift, especially when you can get that constant, it's a tough one. That's a whole different episode. Just to finish up here, I'd like you to just, what's the biggest, two quick things. What is the biggest difference between psychotherapy and ADHD coaching? And what is the biggest challenge to psychotherapy for ADHD?
The biggest difference between psychotherapy and coaching, if you're going to see a coach, presumably you're not, like, everything's stable, managed, controlled, right?
Right.
So you can go see a coach that isn't a mental health clinician for ADHD. If you're not, if like, it's not that you can't have other stuff, it's that whatever the other stuff is that it's well managed.
Right.
And then you're kind of working on strategies, you know, for your daily life. So maybe that's about how you manage yourself, how you calendarize, how you connect with and sync with your family and workplace. So like tactical, everyday, day by day, how you actually execute your life. To me, that's what the coaching piece is.
Perfect.
And I would say you can still see a coach if you've got other stuff going on, but I would say then if your coach is also a mental health clinician, then you can kind of, you know, kill two birds with one stone there, right? Because if you still got a lot of active anxiety, for example, which a lot of people with ADHD do, then, you know, you want to make sure that you're safe. And so you're not going to do interventions that will inadvertently exacerbate your other mental health conditions.
Right. So
that's an ideal world. I mean, there's not enough of us, right? So
no, but what I also heard there was, you know, sometimes taking care of your mental health first is critical before you can get active coaching for strategies.
I think so. Yeah.
And from my experience, that makes sense. Once you can get a handle and get it on the road to recovery on the mental health aspect, now you're more open and understanding to be able to start dealing with strategies. Because
100%.
just a therapy, you got a lot of other strategies you got to try and work out, and that takes time.
Yep.
So wow, I learned a lot. Thank you, Christina. Like, to me, the big one, the coaching works on strategies a lot more about executive functioning. It's not a mental health support. Majority, if you're able to get someone who's got both skills, I agree. But I think a lot of people, when you're looking for coaching, a lot of people don't have that mental health training. If you know, if we're going to Google it right now.
Yes, it can be very murky. Like, people should know coaching is regulated. Anybody can call themselves a coach. Yeah. The theory of coaching is like, I had a success, here's how I did it, and I'm going to market my plan for all of you. So you want to do how I did it. So it's you're following a coach's way.
Yeah.
And
And
therapy.
see if it works for you. And see if
Yeah.
it works
And
for
it
you.
may or may not. I mean, it might, which is great if it does. Right. But people are really vulnerable out there.
Yes.
And so,
desperate, and then they can get in the wrong spot.
Yeah, it can be scary too. Yeah.
So, and then for me, the other thing I got out of this was psychotherapist is talking therapy about psychological change, about healing trauma, mental health conditions. And that counseling is not the same as psychotherapy. It's more about advice giving.
Yeah.
And
it is more advice giving. And
yeah.
I will say, for example, so this kind of confuses people. So there's a type of therapy called cognitive behavioral therapy.
Yep.
And all three of these groups of people could use CBT, cognitive, but in different ways. The way they deploy it is different.
Yeah.
I would say.
So psychotherapy, psychological change, heals trauma. Talking therapy, counseling is about advice giving. ADHD coaching works on strategies, mainly about executive functioning. And Christina, the expert, is recommending to make sure that your mental health is managed, so that you're more open to receive and be successful with any ADHD coaching that you're looking for.
Yeah. And if you're working with a therapist that doesn't have ADHD expertise and you have ADHD, it doesn't mean all is for naught. It just means that it's okay to tell them that certain things they try, or you'd like to try something different because your brain's not processing how they're doing it.
It's not
it doesn't mean your brain is doing it wrong.
Right.
It means the approach needs to be adapted to you. That's what personalized care is. And I think most, if not all, therapists do want to do that for you. They just don't know that there's something maybe not landing. And being able to talk to your therapist about something not landing is a wonderful evidence of a great relationship. If you feel like you can't do that, there's lots of therapists out there. Find another one.
Well, hey, this is your mental health. This is your life you're talking about. And if that person's not providing you the service and the help that you require and request, you move on, and there's nothing wrong with it. And I think if you go to your psychotherapist, your counselor, even ADHD coach, you say, hey, it's not working for me, we need to try something different, and they don't want to try, then you know what? They're not really there for you. Time to find someone else. And like I said, I got lucky with my psychiatrist. I landed a good one. But I went through quite a few different psychotherapists, social workers, and counselors before I found someone that's working well.
Yeah. And through CADAC and through CADRA and through lots of,
there's, even Chad in the UK, there's, wherever you are. So to the listener out there, I think a lot of the stuff we were talking about was mainly Canadian based, but I believe the classification we kind of had or discussed is still applicable across the world. I think the medical field still has those separations. In theory, everything's working kind of like we discussed. I'd like to hear from you. If your thoughts about this, you can send it to me at questions@theimpulsivethinker.com. If what you heard is beneficial to someone, please share this episode. Share it with 2 or 3 friends, colleagues, anyone. Just post it on social media for me, please, because this was a great conversation. I think everyone needs to know, understand ADHD, non-ADHD, because I think this is relevant to anyone. And if you can give me a rating and send me some comments, be greatly appreciated. Christina, as always, fantastic conversation. This could have been a 5-hour episode, but I got other things to do. Sorry.
It'll be like that at the CADRA conference in the fall, Andre. That's like a marathon of immersing in ADHD.
Right. Yeah. And then CADAC also has their annual. It'll be virtual this year in the fall too. So take a look at that. And then I think Chad's got one in the fall also. Okay. There's lots all over the place. So there's a lot of opportunities to learn about ADHD, the brain, the functions, everything. And there's still a lot of research coming out. So thanks again, Christina.
Thank you.
Thank you to the listener for listening as always. And we'll talk to you soon. Take care now.